Well, today's medical segment is brought to you by Harvard Eye Associates, located really close to us, right across the street actually, on Paseo de Valencia. And joining us today is Nicoletta Stefanidis, and she's one of the doctors over there. Thanks for joining us on the program.
Thank you.
You've been with them for nearly 20 years now.
Almost, yeah.
Is the biggest changes is really the advancement in technology in those 20 years?
Yes, definitely. Yeah. Many things in ophthalmology have changed over the last 20 years, and the amount of testing that we do to help diagnose some of our conditions is really increased.
Right, and it's really helping, I think, obviously the aging process, because as we age, you know, the eyes seem to go and then everything else kind of follows. So especially for people our age, too, there's so much hope for people, you know, that are suffering from impaired vision, and then even in the last 10 years to help people with glaucoma and macular degeneration. It's a wonderful thing. But today we're going to be talking about Sjogren syndrome.
Yes.
That's basically kind of a dry eye syndrome?
It is part of a dry eye syndrome, and interestingly enough, I'm going to go through my slides here, but this Sjogren syndrome, it mimics a lot like dry eye, but it's really not dry eye in and of itself. Okay. So the thing with Sjogren syndrome, you can see it's a chronic inflammatory disorder. So oftentimes many of us, as we get older, develop inflammatory conditions, and this syndrome was recognized as something that is inflammatory in nature.
And you say inflammatory, so it's kind of like even like a muscle, like when your knees get sore, but this is actually your eyes.
Yes. So what's going to happen is this is an exocrine gland dysfunction, and what that means is there's two glands mainly involved, the lacrimal gland and the parotid or the salivary gland. Those glands secrete fluids that are, the secretions are on the outside of the body. So the lacrimal gland will secrete tears for the eye. The salivary glands are for the salivation in our mouth. So these gland dysfunctions, what happens is that we have inflammatory cells that infiltrate those two glands, and they cause their production to decrease. So most times people with this Sjogren syndrome will have a dry eye and a dry mouth.
Does one precede the other usually?
Not really.
As a symptom? It kind of happens at the same time.
You know what? This one is difficult to diagnose, so it's not something that's very clear cut, because there's primary Sjogrens and then there's secondary Sjogrens. Primary Sjogrens is just where you have a dry eye and a dry mouth. You don't have any of the other systemic inflammatory. The secondary Sjogren is where you have other involvement: your heart, your lungs, your joints, your skin. All of those things. And basically lymphocytes, which are inflammatory cells that our bodies make, they infiltrate the lacrimal and the salivary gland, and you get this dry eye and dry mouth. What I've said here is that other sites may result in dryness symptoms involving your skin, your nose, your throat, your trachea, or the vagina. Systemic complications also develop in the heart, the liver, the lungs, the renal system, the nervous system, muscles, joints, skin. So you can see that there's a lot of things that can get involved in a secondary Sjogren's.
Right.
Yeah. The thing with this syndrome is that it has an increased incidence for patients with lymphoma. So they see patients that have lymphoma may have this Sjogren syndrome.
So is the discomfort just the dryness in the eyes, and then you all try to diagnose the other symptoms that are coming along with that?
Yeah, with a complete history from a patient. Oftentimes, if they have inflammatory like arthritis, we'll send them off to a rheumatologist if they haven't been to a rheumatologist. And if you go to my next slide there, I just want to do a little overview here. It was just, actually, Sjogren wasn't the first person that described this. It was 1892 by this Dr. Mikulits. And then in 1933, the Danish ophthalmologist Sjogren, he found clinical patients that he could demonstrate that they had a series of dry eyes and dry mouths. And again, I'm just reiterating that it can occur alone or with another autoimmune disease. So it's pretty complicated. It's really hard to diagnose. So we think that the incidence is 1 to 2% in the population, which is about 4 million Americans. But it could be higher, because oftentimes patients don't know that they have it.
Right. They think it's something else, probably. Right.
The thing that it's interesting about this is it can mimic dry eye because it causes a dry eye. So it's not just dry eye, but there's other stuff going on. And you can see that severe dry eye If you have a severe dry eye, you can get all of these other things on the eye: corneal scarring, ulceration of the cornea, infection in the cornea, or even perforation of the cornea, which can all lead to really bad things.
Absolutely. Wow.
Yeah.
Now, do people that suffer from allergies, do they have a tendency to actually, have this as well, or is it just happens no matter?
No, I don't think we know that.
It just happens.
Yeah,
Okay.
right. Things that when we think about dry eye, when we see our patients, so we're trying to figure out what is the differential diagnosis for this syndrome. And a patient could just have a blepharitis but not have Sjogren's. They could have dry eye syndrome but not have Sjogren's. So again, it's a complicated diagnosis. Other things like juvenile arthritis and keratopathies are corneal issues like dryness on the corneal surface. So all of these things may look like a dry eye, but there could be underlying Sjogren's.
Right.
So very complicated.
Yeah, so as a physician, it must be difficult to try and diagnose this because, you first come in, it's like maybe some dry eyes, and you give them, and a lot of people use the liquid tears now, so they think they're helping.
That's it.
Yeah, that's it.
Yeah.
But
oftentimes patients will come in. Most patients with Sjogren's, they know it because they've been to their doctor, they've had the blood test done, because we'll talk about that, and they're often carrying a water bottle because their mouth is so dry.
No kidding.
Yeah, and they'll tell you, I carry this water bottle because I have Sjogren's.
Wow.
Yeah.
So at least they're being educated nowadays too, so the diagnosis isn't as long.
It does affect females more than males, 24 to 1. Yeah. Usually in the menopausal or perimenopausal, average age is like 52.
Wow.
But you can see it in 20 to 30-year-olds. So.
Amazing.
But these are some of the ocular signs and symptoms that are similar to those in dry eyes. You can have burning, stinging, itching, foreign body sensation, sandy, gritty, lid irritation, sensitive to light, photophobia, ocular fatigue. Anytime your eyes feel dry, the eyes feel tired, and discharge. So all of those, we see that in regular dry eye, but you can also see this in Sjogren's.
Let's see the next one. There you go.
Well, how do we know if it's dry eye or Sjogren's? Well, some of the clues for dry eye is that patients with a real dry eye have a diurnal fluctuation. They'll wake up in the morning, their eyes will feel dry or red, or they get it in the evening, so at different times of the day. A patient with Sjogren's would have it all day long. Yeah. Also, a dry eye, sometimes the symptoms of a dry eye during specific activities, like in the car when the vents are blowing on them, or if they're outdoors and it's windy. If they're walking their dog in the morning, patients will come in and they'll go, God, my eyes feel so irritated in the morning, and they go, well, what are you doing in the morning? Well, I'm out walking my dog.
Wow.
Those are more of a dry eye versus just Sjogren. Common for symptoms become worse at night or upon awakening. Air conditioning, smoky, windy environments, airplane travel. A lot of people, I will tell them, if you're on the airplanes, make sure you're taking your tears. Activities such as reading and working at the computer or watching television, oftentimes that will cause a dry eye because we're not blinking as much.
Right.
When we concentrate on those activities and we're not blinking, then what happens is our surface dries.
Right. You're straining more. It's more so, right? Right.
So those are just some of how do we tell the difference between a dry eye and a Sjogren's syndrome. But really with Sjogren's, it's really getting a good history from the patient and asking about their underlying systemic conditions.
And that's really the white blood cells that are attacking in some way,
no,
or do they do that anymore?
It's lymphocytes, which are technically T cells that our bodies make. Our bodies make T cells, and the T cells go everywhere. And in our eyes, they hide in the cul-de-sacs of our tissues. And so we think dry eye is more of an inflammatory condition.
Wow.
Yeah.
Amazing. So is this condition increasing in the 20 years or so, in the many years you've been practicing, or is it pretty much leveled off?
No, we see a lot of dry eye, but I think the Sjogren syndrome, we have a lot of patients with it, but we probably have a lot that are undiagnosed.
Okay.
Yeah.
Wow.
And so seeing their rheumatologist and their primary care doctor is probably important if they have some of these symptoms.
Right.
Yeah.
And if they have these symptoms, do they do a blood test, and that'll work right away? And what are they looking for when they do the blood test?
Yeah, let's go to my next slide and let's see where I have, let's see here. These are clues. Okay, so with Sjogren's syndrome, you're going to have a triad, a dry eye and a dry mouth, and also an autoimmune. You have to have all of those to have Sjogren's. So 2 of the 3 must be present to qualify for the diagnosis. But for a definitive diagnosis, some of the things we look for is a low Schirmer test, which is a tear test we do in the office. Objective evidence of decreased salivary gland flow. Patients will say, my mouth is always dry. I can't get enough saliva going. And then evidence of the lymphocytes that are infiltrating these glands. And they do that by a blood test. Let's see, the next one, what they do is they do a blood test and they look for the antibodies in there.
Okay, let's take a look at the next one and see what we have.
So diagnostic, these are some of the things that we do to diagnose a dry eye or leading to a Sjogren's. All of these tests, though, are variable in their specificity and sensitivity. So again, objectively, it's hard to like do the test and go, oh yeah, you have that. For Sjogren's, you really need the blood test.
Okay.
Okay. The next slide there. Well, once we diagnose it, then we just have to maintain the integrity of the tear film. These are just some of the things that we do, and I think we've talked about these many times. Omega-6 fatty acids, fluid ventilated, gas permeable. That's for a very, very, very dry-eyed patient. Sometimes you'll use a steroid on top of the eye. Sometimes we'll put plugs in. Sometimes we do a little procedure where we actually lift the lower lid. That's the surgical procedure.
Right.
Humidification of the environment. Oftentimes I advise patients to use a humidifier at night in their bedroom. And then for really, really dry patients, we use an amniotic membrane, which is a natural occurring membrane that you actually put over the surface of the eye and help heal it.
Wow.
It's a short-term.
Do they ever basally become healthier once you start treating it? Does it ever go away?
No, it doesn't go away. So
away.
you have to really just try to maintain the integrity of the surface. So I think once you get these things, it's like hard.
Yeah.
Precautions that we tell for patients who have a dry eye is LASIK surgery. You may not be a great candidate, but maybe you are. We'll have to see. If you are taking non-steroidal anti-inflammatories or if you're immunosuppressed, you should have good communication with your internist.
Right, absolutely.
Yeah.
Wow.
Let's see, what else is on there?
I think you have one more, so that's it?
Was that
okay.
it? Yeah.
Well,
Yeah.
it's amazing, you know, that there's so many symptoms too, but yet you know, you really need to go see your physician and then start that process.
Yeah, if it's really bad, patients will, like I said, most patients who have Sjogren's, they may be complaining to their primary care doctor.
Right.
And then the primary care doctor is going to pick up and go, oh, I better do some blood tests to see if this patient has Sjogren's.
Now, when they do the blood test, what are they looking for in there?
They're looking
for a count?
autoimmune antibodies in the blood.
Okay.
Yeah.
Wow.
So it's interesting.
Very much so.
Yeah.
You must be a really good Scrabble player because these words are incredible.
Yeah. I think I need to make them a little simpler.
Wow.
Yeah.
That's
no, I'm
amazing.
not a good Scrabble player.
Well, those are some good Scrabble words there, but it's also very good information. So if any of you out there are suffering from dry eyes, or you feel like maybe your loved one is, having these symptoms, the very first thing to do is go see your primary physician, and then get you to some experts who really know, how to, get this process, taken care of. And like you said, it doesn't really go away.
No.
You're just going to try and maintain it.
Right.
So.
Especially for the eyes. To try and be as comfortable as possible.
Yeah. Well, thanks.
I wish we had a cure.
Yeah. Well, maybe, you never know in the next 5 to 10 years, the way technology is going, those cures will come.
We'll see what happens.
So we hope so.
Yeah.
Thanks so much for joining us on the program today.
Thank you.
That's Harvard's Eye Associates, and that's medical segment for today. And if you have any conditions that you feel they could help you out with, be sure and give them a call, located right across the street from us here in Laguna Woods. We'll be back with more of our program right after this.